My name is Norilyn and I'm a registered nurse. Today I want to talk to you about the things that you can ask a nurse or you should ask a nurse when you are in the hospital as a patient or an advocate or the voice for your patient. Um, Bottom line is you pretty much can ask anything at all. But to give you an idea, the best questions to ask and maybe things that you probably do not know and you can ask are the following. Number one, when the nurse step into your room, you can ask the nurse, have you washed your hands? Because we know that the number one way of preventing transmission of bacteria and viruses is washing our hands. So do ask the nurse if they have washed their hands before they touch you, do anything in your room. Number two, ask the nurse, who is my doctor and what is his specialization? So ask those questions if you do not know who your doctor is and what kind of specialty the doctor has. You can also ask the nurse, what is his phone number? Because if you are alone in the hospital, especially these days that is pandemic, some hospitals still do not let anyone visit the patient. It's still not allowed. For some hospital, they do allow it now because the cases are going down. In our area, it's going down. Thanks God. But in other countries or in other areas, they're still not allowing visitors in the hospital. So you can ask um, the the nurse, what is the phone number that I can call the doctor? So, that's a very good question. So you can ask and call the doctor yourself for your patient, and you can discuss the progress and the plan of care for the patient. Another thing to ask is, am I making any progress? Ask that question. Am I getting better? So that's a very, very good question as well. Another thing to ask is, what is my care plan? So some nurses would not actually use the word care plan. Some nurses would say, okay, this is what's going to happen. So basically, that is your care plan. She will probably tell you, I usually tell my patient things like this. Okay, this is the plan. So if I tell you this is the plan, basically I'm telling you that is your care plan while you're in the hospital. I will say, for example, okay, Mrs. So and so, what is going to happen is this: you need to go to the MRI to have a brain scan or a CT scan or a MRI of the brain. And then tomorrow you're going to have an EKG in the morning. At 4 in the morning, they're going to draw blood draw. So that is the plan or the care plan. But if the nurse does not tell you that, you can ask yourself, okay, what is going to happen? What is my care plan? Another question to ask is, tell us your pain. Are you having any kind of pain at all? Sometimes we do ask, sometimes, or usually we ask. We will tell you, we will ask you, do you have any pain? Are you having any pain? But if you are the kind of person who do not show any pain at all visually, that we can see, sometimes we will forget because probably you're smiling, but actually you are hurting or you're actually having an extreme pain. You need to tell us. Another thing to ask or discuss with your nurse is your concerns. If you have any concerns at all, please discuss it with your nurse. For example, if you are the kind of person who needs a sleeping pill before you sleep, do tell it early. Do not ask for a sleeping pill if you find yourself at like 3 in the morning and still awake. Um, like if you forget to tell your day shift nurse that you need a sleeping pill to sleep, do tell your night shift nurse very early at the start of the shift, and do not wait till 2 in the morning or 3 in the morning to say, I really need a sleeping pill because that's the only way I can sleep. Or you can probably say, hey, I need a earplug because it's very noisy here and I need an earplug. Um, Things that will make your stay a little better. So ask, share your concerns with your nurse. It doesn't necessarily mean like things like that. You can tell, hey, how am I going to pay for my hospitalization? So the we can actually call for the social services, or for the people downstairs, because I really do not know how actually patient pay their hospital bill. But we can ask the charge nurse, and we can ask someone to talk with you during the day, so that to ease your concerns and so that your questions will be answered. Another thing to ask is to explain ask the nurse to explain medical terms. If we keep using medical terms that you do not understand, ask them, what is that? What are you saying? So I do not understand that word. For example, if we keep saying that, oh, you had TIA, you had basically a mini stroke, but we are not using mini stroke. We keep saying, oh, you had TIA, a TIA. And you say, what is that? It's transient ischemic attack. And you still do not understand. You have to ask us, so what does that mean? I do not understand the medical term. So please do ask the nurses, medical terms that you do not understand. Another thing to ask is your lab results. Here in the US, doctors are very fond of um, ordering blood draw, like daily blood draw, sometimes multiple times a day. You can ask the nurse the results of your blood draw. You can ask the nurse the result of your x-ray, the CT scan, anything that has been done. You can ask the nurse those questions. It doesn't mean that we will be able to answer all the questions right away, because sometimes it takes a few days, it takes a few hours, and sometimes the best person to actually tell you the result is your doctor. But most of the results we can probably discuss with you. So do ask the nurse about your lab results, your x-ray, or anything like procedure that has been done, so that you will be up to date, you will know what is happening with you or your patient. Actually, when before you get discharged, if you are the kind of person who wants to get the result of all the things that has been done to you, like the lab works or the x-ray or the CT scan or MRI or anything like that, you can actually ask for that. We will ask you to fill up a form so that you can put the your date, your name, your phone number, and your address if you want the results to be mailed to your house, or it can also be picked up. We will also tell you that it probably will cost very minimal fee for you to get these results. Another thing is you can ask for your food. If you are very, very hungry and it's in the middle of the night and you're like starving and you are allowed to eat, ask for something, ask for some food. It will probably not the best food ever, but if we have something in the kitchen that you probably will like, we'll give it to you. Do not wait for like 6 hours. And I'm like, oh my gosh. Of course, this depends on the kind of diet that has been ordered by the doctor. We cannot actually give you anything that is not ordered by the doctor. For example, if the diet is NPO, which basically means you're not supposed to eat or drink anything, we will not be able to, of course, give you any food at all. So it just depends on the diet that is ordered. But as I said, if you are like hungry, do ask the nurse, hey, may I have some food? Another thing that you can do is change your nurse. Yes, you can actually change your nurse if for some reason you do not like your nurse, you do not trust your nurse, or your family member do not like your nurse for some reason, they can actually ask for a different nurse. So ask the nurse that you want to talk to the charge nurse. The charge nurse will go to your room, and then you can ask the charge nurse, I want a different nurse. And usually the charge nurse will give you a different nurse. Some patients, some family members, they just want a different gender. Um, some patient, they prefer a female nurse instead of a boy nurse. So sometimes that's just the problem. They're more comfortable with a female nurse. Or some family members, they want a male nurse. So yes, you can actually change your nurse. But just be mindful though, because of the pandemic, there's actually a shortage of nurses because there's a lot of nurses who pass away because they themselves got infected, got sick, and passed away because of this. And also, a lot of nurses have resigned or retired because of the pandemic. So just be mindful. Another thing that you can do or ask is you can change your doctor. Yes, you can change your doctor. If you do not like your doctor, you do not trust your doctor, you may have a second opinion, or you can actually get a different doctor. Just be careful though, because um, not be careful. What I mean is, just be sure that the doctor that you want to take care of you will be able to take you. Because sometimes, even if you want a certain doctor, maybe that particular doctor will not be able to take you just because of he has too many patients already, or he's just too full and will not be able to take another patient. We actually had a patient before, this was years ago. The patient actually is very easy to take care of. But the problem is the family member. The family member keeps firing the doctors of his mother, and he just doesn't like the doctors. But the doctors are extremely good. They're very, very good. They're actually very good. But they actually get stuck also with the patient and stuck with this family member because nobody will take the patient. So he cannot do anything about it. Even though he keeps firing the doctors, he wants different doctors, nobody will take the patient. So that's the thing. Um, Another thing that you can do or ask is ask the nurse, when am I going home? When am I going to be discharged? When the doctor already ordered, okay, you are discharged, you can go home today or tomorrow, you can ask the nurse, let's say on that day, what time am I going to go home? So you can call your family member or a friend, the time that they can pick you up from the hospital. Maybe you can ask them, hey, bring me a change of clothes. So you can change. The takeaway is this. Basically, you can ask and discuss anything with your nurse. Remember, you are the boss. You can actually refuse things that you do not want to happen. Let's say you do not want medication. You do not want to take the medication the nurse is giving you. You want to discuss the medication first with the doctor. The next day, you want to basically talk to the doctor first before you take any kind of medication or new medication that you are not familiar with. You can do that as well. You are the boss. Remember that. That's the takeaway. You can refuse procedure, test, blood draw, anything because you are the boss. The thing is, if it's an emergency, we will actually not honor your refusal. If it's an emergency, we will do whatever needs to be done in order to save you and in order to keep you safe and make sure that you are healthy and alive and you get better. So it just depends. If it's an emergency, we pretty much cannot do whatever you're asking if it doesn't gonna get you better, or it's gonna be hazardous for you, or you can be in danger if you like refuse something. Okay. Another thing that you can ask the nurse is the phone number. Phone numbers in the bedroom, in the hospital where your patient is staying, the phone number in the unit, the phone number of the charge nurse, and of course the phone number of the primary nurse that is taking care of your patient. So you can call them directly if you want to talk to the primary nurse who's taking care of your patient. You can call directly. Okay? I think that's about it. I think I pretty much covered everything. I hope you learned something from me today. Thank you so much for watching. Take care and be safe. Bye.